Good afternoon, everyone. It's Hilary here from the PT Council of New Zealand. Got the pleasure this afternoon of introducing you to Wendy Sweet. Wendy's an award-winning presenter and fitness industry leader and educator. She's been involved with the health and fitness industry in Australasia for 3 decades. Her most prominent role has been a long-term commitment to the development of personal trainers since the early 1990s, which has been acknowledged through Fitness New Zealand with their award for the most outstanding contribution to the fitness industry in 2010 and 2011. In 2014, Wendy has just been awarded the Australian Fitness Education Author of the Year. Her master's thesis explored how some of New Zealand's leading personal trainers succeed in motivating and moderating exercise and nutrition behaviours with their clients. And her PhD studies explores the experiences of women in their midlife, undertaking structured exercise with personal trainers. Wendy writes for NetFit magazine and the Australian Leisure Management magazine. Thank you very much, Wendy, for speaking with us today. So everyone sit back and enjoy, and we will see you back in 2015. Thanks, Wendy.
Great. Thank you, Hilary, and welcome to the personal trainers whom I'm not sure where you are, but just to give you a little bit of insight, I'm up in Auckland sitting in my husband's work office, so let's hope that over the next half hour or so that there aren't any interruptions, I should say. Well, Hilary's given me a great introduction, but really my passion, you know, despite all these other things that I've been involved in, my passion is still in education and educating personal trainers. And as Hilary rightly said, what I want to do today in the time that we've got is to give you a little bit of insight and open the door into some of the areas of interest that I have, particularly around behaviour change. I gave this session not this session, but I gave a 2-hour session at the Fitness New Zealand conference on Sunday, and I thanked everyone for attending that, because the people who attended had realised that the psychology of personal training is just as important, or even in some cases more important, than, you know, the physical and the physiology. So I welcome you to this session, and I'm going to go through the presentation, and we'll have just jot down questions as you go, and we'll have a little bit of time to ask questions at the end. And if everyone has to race off on a Friday afternoon, then I will let you know my email address and certainly follow that up. So what I want to do is talk to you about my master's research, which was, I finished that 3 years ago, and for some mad reason I then carried on and started a PhD. But what this master's research was really trying to understand what was going on in our industry, in the fitness industry. And we know that health behaviour change has, I've just gone to the second slide now, so I hope you've all got those up on screen. And really what we do know is that over the past decade, that health promotion per se, so stepping outside of the fitness industry, health promotion has become a lot more interested in all of the interventions that are needed to promote physical activity. So it's not about fitness, it's not about you know, all the things that we have, all the products and services that we have in the fitness industry. So over the past decade, there's been this huge amount of research that has been talked about in health promotion settings. And as some of you will know who keep up with that side of things, there's a lot of different emphasis on different interventions that are happening within the population, and some of these interventions are around, you know, physical activity with our younger generation, so walking school buses and nutrition education in schools. We've got lots going on in businesses these days, because what we do know is that the settings that people are in for the majority of their day are very, very important for engaging them in physical activity. So this is why we've got the boom of the, you know, wellness programs and organisations and physical activity programs and all sorts of things. Then we've got a lot around policy and advocacy. And can everybody hear me? Is that all right?
Wendy, can I interrupt you? Sorry, it's Chantal here from Active Management. Could you just press the Show My Screen button at the top of your GoToWebinar panel? Because at the moment we haven't seen the screen change over.
Oh, really?
Yep.
Where is?
Should at the top of the GoToWebinar panel, there's a little button that says Show My Screen.
Oh.
Give that a click and we should hopefully see the next slide.
Has that done it?
Not yet. If you...
No one can see your screen. Click to start screen sharing.
Yes, that's what we need.
Can see it now? It's on green.
Got it now. Thank you.
Okay, it was on green. I'm not sure what happened there. So this is the second slide that I'm talking to at the moment, and what I was just saying is that there's a lot going on around health promotion in different areas of health promotion, right from the workplace, right through to the environment, right through to healthcare organisations, and for some of you who know about green prescription, through to that. I'm just going to my next slide now, Chantal, so hopefully that will come through. And what we do know, obviously, the big push for health behaviour change has obviously come around the growth in the lifestyle diseases, and certainly obesity and certainly type 2 diabetes. And with obesity and type 2 diabetes, we know that New Zealand is up there. We're second now in the world behind America for type 2 diabetes. We're third in the world behind America and Australia for heart disease. So there's a lot of dialogue, a lot of discussion, a lot of hair pulling about, well, how do we actually enable people to take on board more physical activity? And so we've got lots of debate around snacktivity, we've got lots of debate around the prescription of activity, how much is enough. You all know from the Surgeon General's report that originally it was thought that 30 minutes every day was enough. Now we know with obesity and type 2 diabetes research that it's an hour to an hour and a half. Now we also know that 2 sessions out of that need to be vigorous physical activity. And so there's lots and lots and lots of discussion. And what I keep saying to when I'm educating, whether it's students or personal trainers, is that all of these messages tend to get a bit mixed up, because on one side you've got people talking about heart disease prevention, on another side you've got people talking about diabetes prevention, on another side we're talking about obesity prevention, and somehow all those messages do get jumbled up. So we do have to be really clear about what is happening around the amount of physical activity, the type of physical activity, and not just put everybody into that whole box, and that's another whole session in itself. But the overriding issue is, I've gone to the next slide now, the overriding issue is that we as fitness and exercise professionals, we're most interested in translating people's intention for physical activity into action, the doing it. Where, the government are interested in education programs that help to get people off the couch, but what we have to assume in our industry is that they're off the couch, they've come, they've come and sort you out, or, they've joined a gym or whatever, so they're actually interested in doing something about it. So that was where I kind of started looking at for my personal training, for my master's research around personal training, and I became very interested in the exercise settings as an area where we could be really promoting, helping people turn that intention into long-term action. And what I found when I looked at all of the theories and discussions and models and all of the literature around health behaviour change, that this was the overriding thing that came out of it. And look, the Ministry of Health only released this in 2012, and you can get this report off their website, that no one particular theory or program was found to be consistently superior in bringing about health behaviour change across different conditions. And this was whether it's overweight, obesity, type 2 diabetes, coronary heart disease, whatever. So this is because not all theories or models have been research tested against the desired outcomes for different conditions. So I entered my master's research saying, well, you know, we're getting told to do particular things around motivational interviewing. We've had the theory of trans-theoretical theory thrown down our throats. But what is actually happening around exercise professionals? Because from the early 1990s, I've worked with some of the best personal trainers in the world, and we didn't even know about these health behaviour change theories and models when we got started, and we just had to make it up. We were in the school of hard knocks, and I was really curious about the personal trainers who were doing it really well. They had waiting lists of clients, and what had they learned to do to actually engage their clients in early behaviour change and then keep them there for a long time. So that's what I was thinking about. We know that the size of the industry has grown. They're now just under, I checked with Stephen Gaskell from Reps, and we know that there's now under 2,000 personal training. Interestingly enough, IBIS World, which is the organisation that works with the fitness industry, club industry in America and on a global scale, say that personal training is one of the fastest growing areas that they're expecting, certainly over the next decade. So we're in the right jobs, but now what we've got to do is become, you know, really regulated, really understanding how we can improve what we do, particularly around health behaviour change. I just put this picture in, and I found it in the Lancet, and it was a personal training session over in one of the African countries. So we know that we've got the growth of small group training now, boot camps, we've got all sorts of things going on in terms of our products. We also know that there's a number of challenges that face personal trainers, and I've tried to put these around, you know, the different areas that we need to have knowledge in. Certainly leadership. I've got a lot of interest in how we as personal trainers become transformational leaders. There's a lot emerging about that research, and I think that we are some of the best placed people in the business to be understanding what does it take to lead people into change. And maybe if you're interested, that could be my next session. What are we saying? What are we doing? We certainly need to know about how to run our business. We need to know about exercises. We need to know about weight loss. We need to know about, you know, all sorts of things, rehab, whatever. But my area is certainly around the individual, and what is the practices and strategies that we need to have as personal trainers for moderating exercise behaviours of clients, and how can we come up with our own what's called pedagogy of coaching people into behaviour change that is absolutely specific to our industry. So I have lots of issues around an interest around this particular area. So just moving on to the next slide now. So I have an interest in motivation. We are definitely, you know, our industry is motivation, and if I could call you all, you know, motivators or transformational leaders rather than personal trainers, I would. And what we do know in the fitness industry is that with new clients, you know, we get hit really hard around the first 3 months, and we get this huge drop off in not only motivation of people but also the discipline. So what we do know is because of this drop or attrition, which is the drop off in participation with new exercises, then we do know that there's a gap between what people are thinking when they first come into the gym and first work with a personal trainer, and then how we keep them engaged for a minimum of 90 days. And, you know, and we need that 90 days, that 3 months. And most exercise behaviour research, we do know that with all of the plethora of exercise behaviour research that's come out over the past, you know, 10, even 15 years, we do know that there's a number of, they call them determinants. So determinants are just factors that have been studied from usually psychologists, and they know that there's all these internal and external factors that keep people exercising. And what they've found is, with a lot of the studies that have come out, they know that for exercise, now this isn't exercise in a gym, this is just exercise per se. We know that most studies have found that these two these two critical determinants, perceived self-efficacy and social support, are absolutely significant predictors of exercise participation, especially social support from family and friends. And so what we know in the wider literature around people starting an exercise or physical activity program, then these two determinants, self-efficacy or perceived self-efficacy and social support. And I always, if I could see you all, I'd ask you, what self-efficacy was. But because I can't see you, I'm going to just let you know, for those who haven't come across this term, self-efficacy is people's confidence to be able to make that change. Now, let's break that down even further, because there's two areas of self-efficacy that I believe are really important for personal trainers and the fitness industry. And the two areas that help you build your confidence are, first and foremost, task self-efficacy. And people can either have a high or a low self-efficacy for the task that we want them to do. So they come into an exercise session, they might want to lose 5 kilos, 10 kilos, they might want to bulk up. And so what we have to do is we have to think about what is their confidence in terms of achieving that outcome goal and what is underlying that confidence. And they might have low task or task mastery self-efficacy. So we might put them on equipment that they can't use, or they might, we might program them in ways that they don't feel confident to be able to achieve. And the other, so that's task self-efficacy. The other thing that drives people's perceived self-efficacy is ego orientation. And ego orientation doesn't mean their ego. It means that they will rate their own confidence to be able to achieve what they want to achieve based on whether or not they know someone else who has achieved that as well. So you can start to see, and I always use this analogy, the advertisements that we've seen on television for Weight Watchers, Jenny Craig, alcohol cessation, driver education, they're based on the fact that, over the past few years, we now have seen normal, usual people up on our TV screens saying, look at me, I'm Joe Bloggs, I've lost 20 kilos. And that's because people, when they're looking at that, will orientate their own confidence against other people. So one of the strategies that we have, and I'll get to this a little bit more at the end, but one of the strategies that we have for changing behaviour is to actually talk to your clients about people just like them, or invite them to bring a friend who is just like them, that sort of thing. And then what that does is enhance their self-efficacy for exercise. In terms of going back to the task orientation, the other thing that we have in our toolbox is to be able to get exercises that your clients can achieve, because muscle memory, and the new term is physical literacy, but if people have exercised in their past, in their childhood, in their youth, in their early 20s, we've all done some exercise, we will remember those patterns. It's all about neurological recruitment and muscle memory. So if in your first session, if you've got a client who has low self-efficacy for achieving, the exercise session, then in that very first session, you need to talk to them about what they've done in their past. And if they've walked a lot, then you get them on the treadmill walking, or you take them out for a walk. Or if they have had, a lot of movement patterns in early childhood, they might have played sport, they might have done all these things, then you can talk to them about what they're capable of doing. And this becomes really, really important in obesity research, because with obesity research, there's only certain movement patterns that you can get people to do, because they're too obese to actually, be able to do some of the things. And then the other area that we're really interested in exercise behaviour is this area of social support. And I'll come back to that, because what I've learned through these personal trainers is that you become the social support, not their family and friends usually. So let's have a wee look at this. I've only just put this up on board, this next slide up, because this came out of the Easy Pay survey, and which was the 2013 survey, 19,000 members between Australia and New Zealand. 47% of members of these gyms, from council facilities through to private personal training studios to private clubs, 47% of people in the survey had used a personal trainer. And look at what they'd got out of it. Look at why people are hiring a personal trainer. Extra motivation. 71% of people are hiring a personal trainer because they want motivation, and 58% a better understanding of what to do. So we're really in this game of motivation and education, and we've got to be leaders in that. So let's go through to what I found with some of these trainers that I talked to. So what I did was I've talked to you about what interested me. I wanted to go out and talk to personal trainers who were doing things. They were career trainers. They'd been in the game for longer than 5 years. They were all earning over $80,000 a year. And they, as I say, they had really learned on the job how to change people's behaviour. What we do know, and what I learned, was that they found, and this backs up other research, is that people join exercise for all these outcome type things. They want to feel better, they want their fitness improved, they want weight loss, blah, blah. You guys know all that from being personal trainers. But look at why people continue exercise. First of all, they want to have fun, and I have to say that that's being endorsed through my PhD studies, talking to women especially. They have to like you, they have to like what you do to them, and there's got to be some social component in there. And what I found was that the trainers I spoke to, they were also really cognizant of that as well. Before I get on to the outcomes from my study, what we're finding in the fitness industry, and this is what I'm finding personally, is that a lot of people are telling us to engage with motivational interviewing. And motivational interviewing has come out of mainly the trans-theoretical model, where people, where we know that the trans-theoretical model has emerged as a model of behaviour change. And what it says is that before people make decisions to change their behaviour, they go through a pre-contemplation phase where they're still lying on the couch, and then they work through a contemplation stage, a preparation, an action, and a maintenance phase. So I've done a lot of reading around motivational interviewing, but the thing that intrigues me the most is that motivational interviewing strategies, the studies that have come out of the trans-theoretical model, have been derived from alcohol addiction and drug cessation and smoking cessation programs. And as I started to read about all this motivational interviewing and some of the things that we were being taught, it really comes out of a medical model. And so it really led me to have some curiosity around what is the relevance for personal training. And motivational interviewing is very much the client-centered counselling. So for example, it's a range of questions, and what it does, it would enable me to talk to the client, and this is the green prescription model, but it would allow me to talk to the client, ask a number of questions, but really get the client saying, now what would you like to do? How would you like to fit exercise into the week? So it really gets the client focused on their decision making. But this wasn't what I was seeing in the personal training industry over the years. I was finding trainers were a lot more decisive, a lot more authoritative. So I set out to look at what these 12 trainers were doing from Kaitaia down to Dunedin, and I looked at what their backgrounds were, and I really set out to do some interviews. And I'm just flicking through these slides now. So what were the trainers doing? As I interviewed these trainers, my main question was, what do you do to change client exercise behaviour, particularly when you have a new client? So it was very much their story. I didn't go in there with a number of questions. I just wanted to learn from them about what they did. And I was interested in more about that very first screening session. I wanted to know how they managed the first session, and I wanted to know what they did ongoing. These were the themes out of these 12 trainers and the enormous amount of data that I had and interview material. These were the themes that came up, and these weren't just gym-based trainers. There was a trainer up north who worked in a marae, and she worked in a trust facility. She had groups of very low-income Māori women and males who came in. There were trainers who were working in their own studios. There were mobile trainers. So it wasn't about, you know, and that didn't really matter. It was the fact that I wanted experienced trainers. And this is what not one of them knew each other, but this is what all of them said, that if they were going to change behaviour, it started with them. And I called that walking the talk. Then they devised a number of strategies for not only locking their clients into that first, you know, hit with behaviour change, but they also maintaining the client enthusiasm. And then as they got to know the client and as this client stayed with them, and sometimes I was talking to trainers whose clients had stayed with them for 5 years or more, they called themselves a life coach because it went from, you know, losing, I know specifically one particular trainer, you know, he always said that he had clients coming in for weight loss and fitness, but within 2 years they were doing the coast to coast and they were doing all these other things. So the trainer became very much part of that journey. So the first thing I came up with was that the trainers were confident, knowledgeable, enthusiastic, and I gave them this title of transformational leader. And what that meant is that they were very authoritative, and they were doing stuff that they'd learned to do on the job. And what they'd learned to do was develop different support strategies. And the support strategies were on the physical as well as the psychological. And I'll get into specifics of what they were doing. They all felt that when they started off as a trainer, they didn't know enough about nutrition, and they didn't know enough about metabolic programming and all this to do with weight loss. So there was knowledge that they had to find out, and it was very much, you know, the things that really worked for them. This is just an example of some of the things that they said. And this trainer, who'd been a trainer for 15 years, I feel he's one of the world's best. When you first start off, you've got to get into that client on a physical, mental, or emotional level, because one of those keys will affect the other two anyway. And as an example of that, he always, when he looked at that, you know, when the client wrote down what are the goals for the session, and they'd always write down an outcome goal, which might be to lose 5 kilos, he always unpeeled that onion. And during that first session, he kept coming back to them and saying, why do you want to lose 5 kilos? What's going on in your life? And then he'd typically say, why can't you lose 5 kilos on your own? Why do you need me to help you? So he was really engaging with that client at that level, saying, well, why can't you do this on your own? You know, you're walking 3 times a week, you're doing all these things, you've tried to join the gym in the past, what's not working for you? So he really engaged the client with the emotional as well as the barriers. What has been going on in your life that you've got into this shape, and now you need to learn it. And he said that often people wouldn't disclose that in this first session, but he kept coming back to it. So, sorry, I might have just jumped there. And what I found these trainers were doing, which was different to a lot of the medical modelling around behaviour change, they were really focused on getting the short-term hits. So what they wanted to do was that they were then really getting their clients focused on trying to get that initial weight loss happening. And they found that, just using weight loss as an example, it doesn't have to be weight loss, but really engaging that client in their first session, getting them back, getting them returning. One trainer or a couple of trainers mentioned that their absolute minimum was getting a client in 4 times within 10 days, because what that did was that enabled them to build that relationship. These trainers had short-term strategies around programming, and what they found was it wasn't about, you know, the snacktivity, the incidental activity. That was important, but what they needed to do was have a short-term strategy, and every single one of them said that they designed up programs that worked. And they had weight loss programs, they had muscle gain programs, they had rehab programs, and none of these you could find on the internet. They were programs that they knew could work for all different shapes of, you know, males versus females, all that sort of thing, and I haven't got time to go into that today. they found in their screening form, they used that medical screening form, but they didn't really worry too much about the fitness testing. It was about cutting to the chase. They knew if someone walked in and they were overweight, they looked at them, they could see them visually, they didn't need to do a fitness test on them, they could just walk them on the treadmill for 10 minutes with a heart rate monitor on. So they really didn't worry too much about a fitness test. What they wanted to do was find out more about, I called it cutting to the chase. They just went for the big hits, and the big hits were, Wendy, why do you want to lose 5 kilos? Why can't you do this on your own? And why haven't you been able to do this in the past? So they really stuck through on motives and barriers and obstacles, and they kept coming back to that. So when the client came in for the next session, the very first thing that a lot of these trainers had learned to say when this client was warming up was, what have you done this week? Did you do as we talked about? If not, why not? And they really focused in on accountability. So early behaviour change was critical, and that was authoritative, knowledgeable, and they were like a coach. You know, it was like the All Blacks turning up for a training session. I'm sure Steve Hansen doesn't say, okay boys, what are we going to do today? So that's really what was happening. The communication style mattered, and I'm trying to talk to you in an authoritative fashion, because these trainers had learned to be authoritative, and they learned that what that was, it was a positive authoritative, and they were very, focused on prescription, and there's been a lot of dialogue coming out of behaviour change about the fact that people don't need a prescriptive program, but these trainers found that that's what clients wanted them to do. They wanted to know exactly what they needed to do every single day of the week. It doesn't matter if it was a rest day. So they needed to be quite authoritative, but in a nice manner. And they felt that with authoritative leadership, not barking, yelling at them or anything like that, but really communication style mattered, particularly during the sessions. And a lot of these trainers talked about trainers who just stand back, count reps, and don't really engage with their trainers and be authoritative. They also felt that for some of their clients, particularly clients who wanted weight loss, and I know I talked to some trainers who were in the body shaping game and the competitive body shaping game, they felt that people couldn't engage with the nutritional changes unless they had support in the home. And this has become a big area, and one that I haven't researched but I've read about, is really getting your clients to think about nutrition and what support do they need in the home. Nutritional counselling was huge for these trainers, and even though they knew, and put aside reps, and I'm being a bit out of line for saying this, but they really felt that reps was letting them down because they couldn't do what they wanted to do with nutrition. So they were really focused on that. And this is just some of the things that these trainers said to me. Once a month we do a week of food diaries. They come in, they tell me what they've done wrong, they've marked it themselves. From there on in, for 3 weeks, they're actually pretty good. Then they get back into their old habits, and we work with them again. And this was another female trainer, and she was in Wellington, always asking questions, especially about nutrition, weekly, within our sessions, or by email, text, or phone, always seeking accountability. So these trainers had learned if they were going to get the hit, the nutrition mattered, and they needed to focus on that as well. So what I've come up with is that your initial consultation is absolutely imperative, and the questions you need to be thinking about are getting to the heart of the matter, which is, what is the client doing now, what have they done in the past, and what hasn't worked for them. And then talk about their motives. Why do you want to lose weight? Why do you want to get fit? And just peel back the layers of the onions. But then you keep referring to that in your sessions. You keep hitting them for barriers. You use a motivation and authoritative style. So, Wendy, this is what we're going to do today. You're prepared. And these trainers did that for a minimum of 6 weeks. They were prepared, they were focused, and every single day these clients knew what they had to do. As the clients started to get early results, then the trainers would empower them to start making decisions. Right, Wendy, what are we doing next? Have you thought about running a 5K? And they'd include the clients into some of those more general life change decisions. Nutrition knowledge was important, especially food diaries. So go and get your clients focused on that. So a lot of the trainers were really, interested in having this system of early behaviour change. And I want to leave, I've used up my half an hour already, how quickly that goes, but I want to leave you with this thought here, and this was, I thought, was quite a nice thing that one of the trainers had said. We've obviously done prescription, in terms of exercise programs in the past, and that's what we've been focused on, which was a short fix. But now we can do more than that. We can become, good coaches, good trainers. They pass on knowledge and experience. It tends to be a combination of both. We can teach and encourage people to make changes that are going to last for a long time, changes that they can take with them forever. So I want to leave you with that thought, and I'll open the up to questions. And certainly thank you for your time today. It was a little snapshot. If any of you want to read my master's research, you can Google Wendy Sweet client behaviour change, and I think it's on the web. You don't want to, believe me, you don't want to read the whole thing, but just read the discussion section and the finding session. So thank you for today. Jean asked me to mention that webinars will continue next year. If you're interested in some of my research around my PhD around baby boomer woman, then let Jean and the PT Council team know as well. So Chantal, I'll hand over to you, and if people have got questions, I'm more than happy to answer those.
Thank you very much, Wendy. We do have a couple of questions. So the first question I have here is, how do we connect with the people that we know need to make the change, but as yet they're not thinking that they do? So can you give us some tips on how we might be able to start that particular conversation?
Sure. You need to, and this gets back to marketing and how we're marketing ourselves and what particular market. But if we're going to be part of the behaviour change brigade and we're going to connect with people, I mean, the government are worried about the big population. They're not worried about the 5% that come and join a gym. But if you're going to engage with people, then you need to hit them emotionally, and you need to understand the trans-theoretical model, which is that people sit around that pre-contemplation stage for a minimum of 6 months, and what you need to hit them with is education. So even if they aren't interested in coming and making that first initial step, you need to keep them educated, keep them engaged, keep them enthused. And we all know people who have, inquired about joining a gym or coming to see you as a personal trainer, and then for some reason they haven't turned up, they haven't done all those sort of things. If you've got their contact details, keep them in touch. And what I would do personally, and I'm not personal training these days, but everything I've learned is that I would put together a newsletter, get them on my newsletter list, even if they're training with you or not, and you keep putting forward client successes. And then what you do is you just question, have you ever thought about, why exercise hasn't worked for you in the past? Come and ask me those sorts of things. And that's a whole other area that I could talk to you about for 2 hours, which is marketing. How do you market yourself as someone who's interested in health promotion, behaviour change, and definitely weight loss, type 2 diabetes?
Excellent, excellent. There's so much great stuff that you've already covered off, and this is a hard question because there was so much good information, and we are running out of time. But I'm wondering if you might be able to summarise for us, just in, let's say, 3 quick little points. What would be the 3 main takeaways from everything that you've covered off? Can you summarise just 3 quick takeaways for us all for today? And we might finish on that one then.
Sure. Wendy Sweet and the word summarise don't quite go together, but as many of the trainers know. First of all, your first session matters. And your first session, forget about all the fitness testing that you've learned in academic institutions, of where I've taught it as well. 10 minutes, 15 minutes on the screening form, talk to them, get them underway, maybe do their blood pressure, but get them out there in that first session, find the problems and get talking, okay? Talk to them about what's happened in the past. The second thing is exercise prescription matters. Write it down, lock them in and say, next time you come back to me, I'm going to find some more exercises. You want them to report back to you within, you keep in touch with them around the first 3 to 7 days. What are you saying? What are you doing? At the end of each session, what are you doing for the next 4 hours, Wendy? Where are you going? Where are you eating? What have you got for lunch? it's got to be that focused. It's not about, hi, see you, Wendy, come and see me next week. It's about what's going on today and what's going to happen tomorrow. And the more you can interface and build that relationship, the more trust they will have in you that they're actually going to work towards change. That was more than 3 things.
I just had to take myself off mute. That's wonderful, Wendy. Look, I think we'll wrap it up there, but thank you so much. That was such a fantastic presentation, and I have no doubts that everyone got a lot of excellent information off the back of that.
Sure.
So thank you so much to everyone.
Okay, just Chantal, just my email team is wsuite, all one word, @extra.co.nz.
Wonderful. Thank you so much once again to Wendy, and that concludes our webinar for today.